Welcome to the deep dive. Ever stop and think about how, I don't know, a tiny tweak in how we get nutrients could maybe have these huge ripple effects, especially for really complex health conditions? It's kind of wild when you think about it. Today, we're diving into some pretty fascinating new research looking at exactly that. It seems a very specific form of vitamin D3 might actually help ease some core symptoms of autism spectrum disorder, ASD, in young kids.
Yeah, and our mission today really is to unpack this particular study. We want to figure out why these findings seem different from what came before, and also explore what this kind of innovative approach to nutritional supplements might mean going forward. We'll be looking closely at the science, asking why this specific form of vitamin D3 is getting attention. It's about how optimizing the delivery might unlock effects we didn't think were possible from just a nutrient.
Okay, right. Let's unpack that.
Yeah.
So we need to start with the baseline issue, yeah. It's pretty well known that many children diagnosed with ASD often have low vitamin D3 levels. And this isn't trivial, right? This deficiency has been linked to slower progress in really key areas: think language, adaptive behaviors, even fine motor skills. Just imagine, for you listening, the kind of impact that could have on a child's overall development.
Exactly. That's the critical context.
Yeah.
Because, look, previous studies using just regular vitamin D3 supplements, they gave pretty inconsistent results when it came to actually improving autism symptoms. Sometimes maybe a little something, often not much. This new research, it takes a totally different route. It focuses on what's called a nanoemulsion form of vitamin D3. Now, what's interesting is how it's designed. Instead of just getting the vitamin into the system, this form is specifically engineered to, well, improve how well the body absorbs and utilizes the nutrient. That's the key phrase.
Oh,
That improved absorption and use. That's potentially how you get more effective outcomes, making sure the body can actually use it where it needs to.
So it sounds like the real potential game changer wasn't the vitamin D3 itself necessarily, but the delivery method, how it got in.
Precisely.
That seems like a really crucial difference for listeners to get. It's about bioavailability, which basically just means how much of the stuff actually gets absorbed and is available for your body to use instead of just, passing through. But okay, if the theory sounds good, but how did they actually test this? What did the study look like?
Oh, they definitely put it to the test. The study involved 80 children. All had confirmed ASD diagnoses, and they were all between 3 and 6 years old. And importantly, they were randomly split into two groups. One group got this new nanoemulsion vitamin D3. The other group got a standard, widely available supplement, the kind you might find anywhere. And they stayed on these for a full 6 months.
6 months, okay. And how did they measure if it was working?
They used some pretty robust tools, well-established ones. Things like the Childhood Autism Rating Scale, CARS. That's a standard for measuring autism severity. Also, the Vineland Adaptive Behavior Scale, which looks at, daily living skills, social skills, and the Preschool Language Scale, focusing specifically on communication. So pretty comprehensive.
Right, covering different angles. And what happened when they crunched the numbers? What did they see, particularly in that nanoemulsion group?
Well, this is where it gets really interesting. The results were pretty striking. Only the group getting the nanoemulsion showed statistically significant improvements across several key areas. Obviously, their vitamin D3 levels went way up. The p-value was less than 0.0001. That's incredibly significant statistically, highly unlikely to be chance.
Okay, so it definitely got into their system better.
Exactly. But more importantly, their autism severity, measured by those CARS scores, also improved significantly. P-value 0.0002. And they also saw notable gains in social IQ that was P equals 0.04 and improvements in both understanding language, receptive language, and using language, expressive language.
Wow, okay. That's quite a list of improvements just for that one group. So what about the other kids, the ones taking the regular standard supplement?
Yes, the contrast is crucial here. So the conventional supplement group, their blood vitamin D3 levels did go up significantly too. P-values less than 0.0001 and 0.02, depending on the exact measure. So the vitamin was getting in.
Right.
And this is the key point, these increased levels did not lead to meaningful improvements in the behavioral outcomes. Their CARS scores, no significant change, P-value was 0.4. Their social IQ, same story, P-value 0.8. Basically no real shift in those core areas.
Huh. So the levels increased in both groups, but only the nanoemulsion group saw the benefits in terms of symptoms and function?
Exactly. It really hammers home the point, doesn't it? It's not just about getting more vitamin D3 into the bloodstream. It's about how it's delivered and whether the body can actually utilize it effectively. More isn't automatically better if it's not bioavailable.
It's like having the fuel, but maybe not the right kind of engine to use it properly. The Nanoemulsion seems to have provided that better engine, or maybe the key to unlock its use. So what does this mean then, big picture, for how we think about nutritional help for conditions like ASD?
Well, the study's conclusion is pretty clear on this. They state that the nanoemulsion form of vitamin D3 seems superior to the standard oral form, both for increasing the vitamin's bioavailability and for producing these clinically relevant improvements in kids with ASD. And connecting it to the bigger picture, the authors themselves suggest, and I'm quoting loosely here, that this nanoemulsion technology could offer a valuable strategy for making nutritional interventions more effective in neurodevelopmental disorders generally.
So potentially beyond just vitamin D3 and ASD.
Potentially, yes. It opens up that possibility. Now, of course, they're careful, as good researchers are. They point out the need for more studies, larger groups of kids, longer-term follow-up to see if the benefits last, and also exploring if there are differences, maybe between boys and girls, in how they respond. These are definitely needed next steps before anyone gets too carried away.
Right. The usual caveats in science. Always more questions.
Always. But for you listening, I think the core takeaway today really is about the huge importance of bioavailability. The delivery method matters, especially for complex conditions like ASD. It highlights that sometimes it's not just what supplement you take, but critically how effectively your body can actually absorb and use it.
That really is the powerful insight here, isn't it? And it leaves us with a pretty provocative thought to chew on. If this nanoemulsion approach works so much better for vitamin D3 in this context, where else could it, or maybe similar advanced delivery technologies, make a difference? Think about other vitamins, minerals, maybe even medications we use regularly. Could optimizing how they're delivered totally change their effectiveness? What does that mean for the future of, say, personalized nutrition or therapies? It's definitely exciting to think about the possibilities.